sugar, sugar in fruit. I have no problem with somebody chewing an apple or an orange because there the fructose is bound to the fiber. The absorption is slow and it is safe, okay? However, if you drink orange juice or you drink apple juice, now we got a problem. Because the the fructose is no longer bound to the fiber. In your stomach, it's like a rocket going off. It injures the liver, it glycates protein, and injures the endothelial cell. If you start eating out of a box, a bag, or a can, everything is getting processed. And once you get things processed, then it's kind of changed, and then you suddenly see a box has to have ingredients. Now, if the ingredients are nothing more than rolled oats, for instance, I eat a cereal, and all it is in the box is rolled oats. That's it. I'm getting exactly what I get. But the minute you get, I can pick up any box and any store, and you'll suddenly see, my God, there are paragraphs of ingredients. You don't want that. Especially you don't want the mono and diglycerides, you don't want the added oil, and there are usually 4 or 5 or 6 different ways that they're stuffing sugar at you. Just absolutely many, many different ways of the nomenclature for ways around. Because if they put it all together, instead of having 6 different ways of describing sugar, it would always be the first ingredient. You don't want that. You want whole food, plant-based nutrition as grown. There are wonderful studies that really clearly show how olive oil, corn oil, soybean oil, the oils will injure endothelial capacity to produce nitric oxide. And I mean, to me, it's so incredible to see that, was it 2 years ago, New England Journal, February of 2013, everybody was ranting and raving about this marvelous study out of Spain, 7,000 people who had no cardiovascular disease. They gave them 3 options of Mediterranean diet with oil, Mediterranean diet with nuts, and then the low-fat diet, which was 39% fat, which is much higher than the high-fat diet in America is 34%. So these people were really having Mediterranean diet with oil, Mediterranean diet with nuts, and then a high-fat diet, okay? Well, the study went on. After 5 years, what did they find? Well, remember, the title of the article was The Prevention of Cardiovascular Disease with the Mediterranean Diet. When I was asked by a writer from the New York Times what my comments were on it, I said, I think you got the title wrong. Because remember now, you started with all these people without any cardiovascular disease. And when they looked at the study at the end of it, there had been scores of patients in each group that had either died, had a heart attack, or a stroke in each group. And there was a little bit significantly higher number with the high fat, 39% fat diet that had had a stroke. And I said, I think the title should be The Creation of Cardiovascular Disease with the Mediterranean Diet. Because that's what happened, right? I mean, how can you be proud of a type of nutrition that creates this disease? No weight loss in this group. And when you compare, if they were to compare that group to, say, a group in Central Africa or the rural Chinese, I mean, come on. We're talking about a diet which created the illness. And of course, industry was involved there, the nut industry. I mean, I know that there have been a number of papers, scientific papers, that shows that nuts will improve what we call biomarkers. But when you really put it to the test, like they did in this PREDIMED study in Spain, what did you find? You created death, stroke, and heart attack in the group that was eating all these wonderful nuts. So that's another reason I'm kind of tough on nuts is that with the patients who have heart disease, not that those who don't, but how many people do you know who will eat one nut? I mean, nuts are highly addicting, and they're filled with saturated fat. If Dr. Esselstyn says nuts are fine for heart patients, they'll be in the glove compartment, they'll be in the kitchen, the bathroom, the dining room, the bedroom, everywhere. So we're just absolutely delighted and pleased with the results we're getting now. And I think just to pull it all together, the reason that we succeed is because we are removing the causation of the illness. The causation of the illness is not some strange genes, it's not some stress. The causation of the illness is whether you are destroying the lining of your artery, and that's done by food. Because it's interesting when you look at, let's say, a whole wide range of what we call chronic disease. Let's take an example of hypertension. You graduate from college, you're 20 years of age, you have no hypertension, you're absolutely healthy. You're 25, you're still healthy, but you know, your blood pressure is no longer 110 over 75. Now it happens to be 125 over 80, but now you're 30, 35, and suddenly it's now kind of 140 over 80. But now you're 40 and it's, oh my, it's 145 over 85 to almost sometimes 90. So what do? You start taking drugs. Is it because of a lack of a drug that you developed this disease? No. This poor soul has been taking a hit, a bodily injury, with every meal, every day since college or long before then. And you probably heal 90% of that injury. But that 10% that remains incrementally begins to cause this thickening, inflammation, right? Stiffness of the artery, lo and behold, hypertension. But what we see time and again with these patients with hypertension, we start giving them whole food, plant-based nutrition, and their blood pressure starts to drop. And they have to come off these drugs they're on because they start noticing that when they get up from the dinner table, they get lightheaded because their blood pressure is too low, because you can't give a patient whose blood pressure is now normalizing these strong drugs because they simply will not be able to get enough blood up into the head to keep from passing out or getting dizzy. So what we really have here, and I think the thing that makes me more excited and passionate than even perhaps when I was doing surgery, is that right now medicine is on the absolute cusp of a seismic revolution in health. And this seismic revolution in health is never going to come about through an advance in technology. It's never going to come through from another gadget, another operation, another stent, or even another drug. The seismic revolution in health that comes about will come about when we in the profession have the will and the grit and the determination to share with the public what is the lifestyle, and especially the nutritional literacy that will allow them to be the locus of control that's empowered to annihilate these common chronic killing diseases.